David, in particular, like just for a moment to segue into all the new generative AI technologies that are coming our way. And it's not just about text, it is also about so many different forms of media that it can transform. So, any thoughts that you have where you think generative AI might play a larger role or might be more conducive in the healthcare setting?
Yeah, so in terms of generative AI, one of the solutions we implemented is something called AVO, AVO. And what AVO does, it is ambient listening. So it helps physicians to write the note. So that's part of it, but that's not really generative AI. What it then does is it pulls relevant information from the electronic medical record in order to create a real functioning note.
Mhm.
And it puts in front of the clinician a differential diagnosis as well as the clinical pathways related to that clinical diagnosis. So, yes, it's ambient listening, which is important, but it's also
Yeah,
natural language processing. And
yeah.
then it helps to generate a differential diagnosis and then helps to generate the proper treatment pathway for that patient and presents the note in a way that facilitates the coding, the billing, et cetera, for the hospital or the system to be able to get reimbursed. That has been a game changer for our
Mhm.
clinicians. And thinking about implementation of any new tool is really, really challenging. What we found with the ambient listening and the ambient dictation, there was different level of adoption
Mhm.
between specialists like surgeons versus primary care doctors.